Hi, my name is Tara. I am a grad student with a certificate in human sexuality, working on a master's in the field, and I think we should talk about anatomy. First of all, I'd like to apologize for the varying degrees of sweat that may cross my face. I live in Texas, and it is 100 plus every day this week, and my AC is doing the best she can, but it's toasty in here. I do have powder on standby in case I get too shiny. This is episode one of my Sex Ed 101 series, which will cover the basics of sex ed, the sort of things that you may or may not have covered in school already, but you probably should have. For some reason, sexism and taboo, sexual anatomy is often not covered in classrooms. You may learn the basics of cellular reproduction in biology, but genitalia is often seen as inappropriate or vulgar to discuss with adolescents. But learning about the penis or the vulva should be no different than learning about any other part of your body. I know I needed to learn the names of all the bones in the body, but a survey in 2019 showed that 45% of people surveyed could not point out the location of a vagina on a diagram. And 1 in 5 of the women surveyed believed that they urinated from their vagina. Now, this was a UK study, so good news. It's not representative of everyone's knowledge, but bad news, the UK does have a more comprehensive sex education program than the United States does. So, watching this, you may think, wait, where is the vagina? Or, I know all about the vulva, but what's up with testicles? Well, come with me and let's explore anatomy together. Now, let's start by clarifying that our current understanding of anatomy is still very binary and not the most inclusive. Most anatomical texts do not include intersex genitalia and refer only to male or female bodies, and disregard any nuance that comes with gender bias, racism, or a history of prejudice in the medical industry and field of study. Now, that's a video for another time, but if at any point in this video I refer to male or female anatomy, I am in no way meaning to disrespect trans, non-binary, or intersex bodies, but referring to what a doctor would assign male or female at birth. I will do my best to use inclusive language throughout this video, though. So for those with penises, a large part of the reproductive anatomy is external, meaning there's a little less mystery around the system as compared to those with vulvas. So let's get started with that external anatomy. The penis is made up of 3 parts: the root or base of the penis, where it connects to the abdomen, the shaft of the penis, which contains 3 inner chambers that fill with blood in order to create an erection, and the gland or head or tip of the penis. Covering the head of the penis is a thin layer of skin called the foreskin. This protects the gland's sensitive nerve endings and prevents anything from entering the urethra. Circumcision is a medical procedure by which that thin layer of skin is surgically removed, typically just after birth. This is usually a choice by the parents based on cultural customs or religious beliefs, but it is sometimes medically necessary. While in the US, the tradition has typically been towards circumcision, there is a bit of debate about whether that trend should continue. At the very tip of the glands is the urethral opening, which is where semen and urine are both transported through the penis. The scrotum sits below the penis and is a two-sided sac of skin that contains 2 testes, where sperm and some of the body's testosterone is produced, the epididymis, which is a tightly coiled tube, one of which sits atop each testes, the spermatic cord, and the cremaster muscle. The epididymis stores sperm until maturation, usually about 60 to 80 days. This is where sperm learn to swim. The spermatic cord contains the blood and lymph vessels, the nerve endings, and the vas deferens, which is the road that sperm take from the epididymis to the ejaculatory ducts, which empty into the urethra. The cremaster muscles surround each of the testicles and its spermatic cord. The muscles can then move the testicles closer to or further from the body in order to maintain an ideal temperature. Temperature is really important to healthy sperm production, which is why the testicles exist outside of the body. For healthy sperm, the testicles need to be about 5 degrees lower than the internal body temperature. At the base of the vas deferens near the bladder, the seminal vesicles create a high fructose fluid that makes up some of the semen and provides a source of energy for sperm as well as easier movement. In just 5 milliliters of semen, which is only a teaspoonful, there are 75 million sperm cells, but they are microscopically small, and most of seminal fluid is primarily protein molecules. Also contributing to the fluid that makes up semen is the prostate gland. The prostate is the size of a walnut and serves many interesting functions, but one of its primary ones is to increase alkalinity in semen in order to counteract the acidic environment of the vaginal tract. This is in order to keep as many sperm alive for as long as possible. It also serves as sort of a blender, mixing up all of those components of seminal fluid and then transferring them to the urethra at the point of ejaculation. Wow. Wow. A lot more going on inside than you might realize. And that's just the basics of anatomy for people with penises.
But if you check out an anatomy text, you may notice some of the same or very similar technical names are used to describe the anatomy of someone with a vulva. Now, some of this is due to gender bias in medical research, but what I think is more interesting is to think about the ways in which a biologically male body and a biologically female body are not that different. We essentially have the same parts, just rearranged. For example, the testes and the ovaries perform the same function, creating genetic material. The foreskin and the clitoral hood both serve to protect the glands, the head of the penis or the tip of the clitoris. Those chambers that fill with blood at arousal in a penis also do the same within the folds of a labia. Fetuses have all the same materials, but they don't arrange them until a wash of hormones comes through and gives the body a map for where to put them. This is why there is variation in the ways that intersex people's anatomy presents itself. Variations to typical anatomy can be internal, external, both, or neither. So let's talk about those of us with vulvas now. Let's start with the internal reproductive organs, which for some reason seems to be what we're taught most about in school for some reason. So for a lot of you, this may just be a refresher. The uterus is one of the strongest muscles in the body, which anyone who experiences menstrual cramps can attest to. It is pear-shaped upon reaching puberty and deceivingly small in a non-pregnant person. The average size of a uterus in the body of someone who has reached puberty but has not become pregnant is only 3 inches wide by 1.75 inches tall by 1 inch thick and can contain a volume of about 75 milliliter to 200 milliliter depending on where that person is in their cycle. However, in order to accommodate a fetus, the uterus can grow to 5 times that size and contain a volume of 500 times more than normal. Even without the weight of the fetus in the placenta, the uterus itself will be 15 times heavier at full-term pregnancy, although it will then shrink down to almost pre-pregnancy sizes after giving birth, although it will always be slightly larger. Some of those fluctuations in weight and volume are due to the endometrium, which is a mucous membrane that lines the inside of the uterus and thickens throughout the month in order to support a fertilized egg. If no egg is fertilized or implanted, that endometrium lining sheds and becomes a period. Branching out from the uterus are the fallopian tubes, 2 muscular tunnels, one on either side of the uterus, filled with tiny cilia which work to move the egg from the ovaries to the uterus. When someone with ovaries is born, those ovaries start out with about 1 to 2 million eggs, but by the time they reach puberty, only about 300 to 400,000 are still there. The ovaries also produce hormones like estrogen and progesterone, whose levels rise and fall, triggering and regulating the menstrual cycle, and release 1 egg each month during ovulation, usually alternating between the left ovary or the right ovary, although occasionally an egg can drop from both in 1 month, and that's one of the ways in which twins can be born. At the bottom of the uterus is the cervix. The cervix acts as sort of a gate to the uterus, allowing menstrual blood to exit, but stopping a large percentage of sperm that try to enter. Do you remember those 75 million sperm cells per average ejaculation? Well, only about 2 million of those actually make it to the cervix, and then the cervix stops a million of those. Of that million, only about 10,000 make it to the far side of the uterus, and then only half of those turn the right direction, toward the ovary that is releasing the egg that cycle. Of that 5,000 that's left, only about 1,000 of those make it into the fallopian tube where fertilization occurs, and then only 200 out of that originally 75 million sperm make it to the egg. The egg then has its choice of those 200, using chemical communication to pick an egg that will be most viable for a successful pregnancy. The rest of those sperm end up just dissolving. But the starting point for all of this is the vagina. Probably the most talked about and the least understood part of the anatomy. The vagina is a muscular tunnel connecting the internal and external genitalia. The vagina is where period blood and tissue exits the body, and where tampons, fingers, toys, penises, etc. can enter. The vagina is also often called the birth canal because it is the pathway for the infant during a vaginal delivery. The vagina has an incredible elasticity, like the cervix and the uterus, able to stretch wide enough to accommodate an entire baby, but then shrink back small enough to hold a tampon. The walls of the vagina are structured like an accordion, meaning not only can they stretch in width, they can also become longer or deeper depending on arousal. While there's a huge range of normal, some research shows that the average vagina is anywhere between 3 to 7 inches deep. Anything inserted deeper than this will run into the cervix and be stopped. While the vagina is only the internal structure, many confuse it for the vestibule or vaginal opening, or equate it with the vulva, which is the name for the entirety of the external genitalia. The vulva is actually made up of several different parts. There are 2 sets of labia, the labia majorum and the labia minorum. These serve to protect the vaginal opening, the urethra, and the clitoris. Now, the labia come in every variation of size, color, and shape, and for some, the labia minorum hangs outside of the labia majorum. Unless any of that is causing physical pain, there is no arrangement of labia that is abnormal. The vaginal opening is toward the bottom of the vulva, and the urethral opening sits above that. Note that when we discussed penis anatomy, the urethral opening was actually the exit for both urination and ejaculation. In vulvar anatomy, the urethral opening is just for urination. Above the urethra is the clitoris. The clitoris is the glans, like the head of the penis, and is covered by a fold of the labia minorum, called the clitoral hood, which acts sort of like a foreskin and protects the sensitive nerves from overstimulation. Just like the foreskin, the clitoral hood retracts during arousal. The clitoris is the pleasure center of the vulva, full of nerve endings. While the entirety of the vulva is sensitive to touch, the clitoris itself has 8,000 nerve endings. That's double the number of nerve endings in a penis. The clitoris can also swell to 300% while fully aroused, and is actually a much larger organ than what we can see. The tip of the clitoris is really the only part that's visible, but the entire structure of the clitoris is more like a wishbone, with these legs that wrap around the sides of the vulva and swell on arousal. The clitoris is still subject to much research. Despite there being documentation of the clitoris as early as 200 AD, there hasn't been a ton of research on it in the century since, although there has been plenty of debate. It wasn't until 2005 that MRIs were taken of the clitoris that revealed the complexity of the nervous system and its full structure, like my little model here.
Hi, I have a confession to make. I'm filming this on a completely different day. If you couldn't tell from the fact that I look completely different and the lighting does. I actually lost the last bit of footage. I know a lot about sex and very little about technology, so forgive me as I learn as I go. I think where I left off was wrapping up the discussion of anatomy for people with vulvas, and I really just had one more note to make, and that was on pubic hair. Regardless of what genitalia you have, pubic hair begins to grow at the onset of puberty. Now, pubic hair serves a purpose. Pubic hair exists to protect the genitalia, to reduce friction, to catch moisture, and the oils produced by the hair follicles actually work to prevent the reproduction of bacteria, meaning having pubic hair can actually reduce your risk of infections. Pubic hair, like hair on any other part of your body, has no impact on your hygiene or cleanliness. As long as you wash yourself thoroughly and regularly, the hair on your pubic area is no different from the hair on your head. Now, some people do prefer the look or feel of removing some or all of their pubic hair. The important thing is that the choice to keep or remove all, some, most of your pubic hair is 100% up to the person that grew that hair. So I think that about covers it when it comes to the basics of sexual anatomy. Thank you for watching this video, especially if you've gotten this far. And please like, share with your friends, leave a comment. Let me know if it was helpful or you learned anything new or you have something that you think I should know. Thanks, bye. Fucking.